today we're going to be reviewing the Allstate Health Access plan. Now, this is really a great plan to have in your portfolio of plans to discuss with your clients. And really, the reason I say that is because of its versatility. This plan has a great amount of versatility and options that your clients can use and that you can review with your clients. Now, this plan is a fixed benefit medical plan. It does offer an easy and affordable way to help your clients pay for everyday health costs. And the good news is it is available in a large number of states. Now, for those of you who are unfamiliar with what a fixed dollar benefit plan is, that is what this plan is. The fixed benefit plan that we're going to be talking about is a fixed benefit. What I should say is a fixed dollar benefit plan, which means that the plan does not have a deductible, nor does it have a copay or co-insurance or other out-of-pocket requirements before the plan actually start covering the benefits. Instead, what happens is payments for coverage benefits start from the very moment an insurable event occurs. So there's no financial pressure placed on the policyholder in order to receive benefits, which is pretty awesome. You should note, however, and I hope you guys are taking notes, you should note that this plan does have a 90-day waiting period, but only for preventative care. Now, for those who live in the state of Pennsylvania, the waiting period is only 30 days, so it's a little bit less time than in other states. The great news is that coverage for sickness and injury benefits, those start immediately. Okay, so that's just a little bit of information before we really dive deep into this presentation. So what we're going to be reviewing today is we're going to be taking a look at introducing you to this fixed benefit indemnity plan called Access. And then we're also going to look at the options, how the plan works. We're going to look at the plan details as well as the resources that are available to both you as agents and to your members as well. So why should someone consider using a fixed benefit plan? Well, there are a number of reasons. The first is 64% of Americans avoid or delay treatment due to medical costs and would appreciate more money to help them pay for those costs. Now, this next one here, this one hits home really closely. 44% of Americans do not visit a doctor when sick or injured because they do not know how much the visit is going to cost. I will tell you from personal experience, my mother-in-law was in this situation. My brother-in-law had juvenile diabetes, and she was more concerned with getting his care than her care, and she was afraid of the cost of her care if she went to the doctor, so she avoided going to the doctor. Ultimately, this did cost my mother-in-law her life, and she ended up passing away from something that is very curable today. So this is a real problem, guys, and this really touched close to home. 41% of Americans have problems with medical bills or debt bills due to healthcare costs. In preparation of this presentation, one of the things I did is I wanted to see how bad the problem really was when it comes to medical bills and debt. 66.5% of bankruptcies are caused directly by medical expenses, making it the leading cause for bankruptcy. Guys, that is absolutely huge. What we can do by explaining to our clients plans like this, We can help avoid a lot of these problems if we educate our clients and we make sure that they know that these are options for them. So why a fixed indemnity benefit plan? Well, there's a number of reasons. As I stated earlier, it gives our customers a way to get affordable health care that they need. It also helps to cover those anticipated costs of everyday health care. It pays a set dollar amount for certain covered healthcare services without the need to worry about deductible and other out-of-pocket expenses. The other thing is that something that you definitely want to note and you want to mention to your clients is that the customer pays anything in excess of their plan benefit. So let me explain what I mean by this. If you have a customer that goes into the hospital or has some kind of injury that end up costing them $100,000, and that is what they are billed. Well, say if they have one of these plans and this access plan covers $9,000 of that $10,000, that leaves a delta of $1,000. That $1,000 that is remaining is the responsibility of the customer to pay. So something you want to make sure you are aware of is this is a fixed benefit plan. This is a first dollar benefit plan, which means it is paying benefits to the customers that will go to, or the policyholders that is going to go toward paying their bill. Anything in excess of that, they are responsible for. Here are some highlights when it comes to the Health Access Plan. It is a fixed benefit indemnity plan that offers customers affordable and predictable access to health. We have said that. There is no deductible, no copay, no surprises when it comes to the benefits that are given to the clients once they are enrolled in this plan, and benefits for both preventative and unplanned office visits, labs, x-rays, confinement, such as in the hospital, surgeon costs, those are all included, and there is no waiting period for injuries and sickness benefits. Just remember, there is a waiting period, which is 90 days for the preventative care. I'm curious, and I want to make sure you guys are listening. Why do you think Allstate has said that 90 days is a required waiting period for preventative care? Why do you think that's important? Put it in your chat. Okay, close. You got it. Nora nailed it. A lot of times what happens is people will get this plan because it is a great plan with great benefits. They will go ahead and get their physical, and then right after that, they'll cancel it. So that is the reason why there is a 90-day waiting period for preventative care. So I wanted to clarify that with you guys. So who is Access fixed indemnity plan good for? The plan is a great option for those who cannot afford major medical plans, want help covering costs that other plans do not cover, need help paying for health care expenses. Who is it not good for? And this is questionable. So when I'm done with this, I'm gonna challenge you guys a little bit. Who is it not good for? Utilize a lot of Medicare medical services or need ACA coverage, want comprehensive medical coverage, have a serious illness or chronic condition, or are eligible for an ACA plan subsidy. Okay, so let's talk about this piece right here just a little bit. When it comes to the Access Health Plan, one of the major benefits of this plan is that this plan can be sold as a standalone plan. It can also be sold with an ACA plan. It can be sold with a short-term medical plan. It can even be sold with employee sponsored plans, so employee health sponsored plans. This plan can even be sold with that. So when I talk about the versatility of this plan, that is what I'm talking about. One of the things that I'm talking about, because you don't have to just sell this as a standalone. This can be paired to help fill gaps within other plans. So let's talk about the ACA. One of the things that it says on one of these bullet points is that it's not suitable for someone who is eligible for an ACA plan with a subsidy. Well, I'm going to say that I beg to differ, you guys. And the reason why I beg to differ is because the ACA plan nowadays, as you guys know, with the new rules and regulations that are out there, there are more people qualifying for subsidies now than ever before. You have people with very decent incomes that are qualifying for subsidies, which is giving them more disposable cash. However, ACA plans, let's talk about that for a minute. ACA plans without a subsidy, first of all, is very expensive, so we should be looking for other options for them. But ACA plans with the subsidy is actually making it easier for them to actually make their payments, which means, like I said, they have that disposable cash. But one thing that does not go away is that maximum out of pocket that they have to pay. And right now, guys, for an individual, what is the maximum out of pocket on an ACA plan? Please put it in your chat. Almost 10, not quite. It's working its way up there. Heck, $9,100. Renee got it. What about with the family? What is the maximum out of pocket for a family? You got it, James. $18,200. That is a lot of money. I don't know about you guys, but when it comes to those type of dollar amounts, I don't want to spend my savings and give it to a healthcare facility. I would like to get some help so that I can keep my savings. This particular plan is going to allow for that particular help, because when this is paired with an ACA plan, then you have direct dollar, or you have instant benefits that are paid on top of what the ACA is paying. So it helps to fill the gaps when it comes to these high deductible plans. So when I'm reading this, I want you guys to think outside of the box a little bit, because this plan is really a great plan for someone who can afford it, who need to be on an ACA plan, whether it's because they have a subsidy or if they need an ACA plan because they have a very serious illness. But either way, it's the conversation we need to make sure we're having with our clients. Okay, so what we're going to look at now is we're going to look at the benefits that are involved in this plan, and we're going to look at the network. I absolutely love the network in this plan as well. As I do this, I'm going to put out a clear disclaimer up front so I don't have to keep repeating myself. Within this plan, just like with any plan in insurance, health insurance, the benefits vary by state. So as I go through this, please note that the benefits do vary by state. You do need to look at your brochures to make sure that what is being offered and what you are quoting is something that is available to the folks within your state. Okay, so let's go ahead and look at the benefits with this particular plan. Now, there are 6 plans to choose from with the Access Fixed Benefit Plan. We have the Value Plan, the Fundamental Plus, the Enhanced Plus, and the Guaranteed Issue. Now, each plan offers a different benefit depending, and as well as a different maximum benefit per year. With the plan, they're all different with each one of the different types of plans that we have here. Now, this is very important and very crucial, what I'm about to say to you. When you are looking at this plan, don't assume that as you are looking at this and you're going from value, fundamental plus, and on, that each level is going to be a better plan or is going to offer more benefits, because that's not necessarily true. Each one of these plans offer different benefits based on the needs of your customers. So it's very important for you to look at each one of these plans before making your recommendation, because if you look at the Enhanced Plan is our most popular plan that we have here at Allstate. If you look at that particular plan and you assume that the Enhanced Plus plan is a better plan because it has the word plus associated with it, you would be wrong. So I want to make sure you guys are aware, make sure you are paying attention to the actual highlights of each one of the plans before you are making your recommendations. So is there a restriction on the owner? No, with this particular, that's a very good question, Christine. With this particular plan, there are no restrictions in owning this plan along with another health insurance plan, even if they're getting a subsidy. So it's a beautiful, beautiful option in that particular sense. So now let's take a moment to review the benefits. So first, we're going to look at the hospital administration benefits that we have here. So it does vary based on the different plans that are out there. This is a hospital admissions benefit. So that means that when someone is admitted into the hospital, that is what triggers this particular benefit. The benefit ranges from $500 all the way up to $1,000 per admission, and the maximum benefit per plan year ranges from 3 all the way up to 10 admissions per year. Next, we're looking at the intensive care. Next, we're looking at the intensive care and the intensive care sick inpatient benefits that come along with this plan. Now, one thing that I want you to note, and this is going to be applied to this slide and the next slide, you should note that the benefit payable when confined for treatment of sickness differs from the benefits that are payable when confined for treatment for injury. So that's why we have the 2 categories listed out. Now, additionally, as you will see on the next slide, that the benefits payable for confinement in intensive care in that type of setting also differs from the benefits payable in a non-intensive care facility. So I want you guys to notice that as we are going through this. Give me 1 second to look at the question. Okay, Lisa, I will address the observation in a little bit. I'll come back to that. The benefits are per person. Great question. Okay, so with the facility, so you have intensive care facilities and you have non-intensive care facilities. With the intensive care facilities, the benefit amounts are different than what they are with the non-intensive care. And that will make sense when I get to the next page. So just give me a second and you'll be able to see that. So in looking at these benefits for intensive care, this is for sickness. The dollar amount of the confined benefit starts at $2,000 and it ranges up to $4,000. The maximum benefit per plan year is 60 days for each one of the different plans. Now, if someone is in intensive care due to an injury, the per dollar day of confinement ranges from $4,000 to $6,000. The maximum benefit per plan year is also 60 days. Now, the next thing we have on here is the healthcare practitioner visit. This is when someone is in the hospital and the healthcare practitioner is coming in to make their rounds and their visits to see how you're doing. That's a line item on the EOB. So the per visit benefit on this when confined starts at $50 here and it goes up to $75. The per benefit per plan year ranges from 1 with the guaranteed issue plan all the way up to 10 with the fundamentals plus, the enhanced, and the enhanced plus plan. So I'm going to stop here and see if we have some more questions. And someone please, a question to everyone. Okay, so you should be seeing it to everyone. I have set the questions so that everyone can see the questions. So you might want to check your settings to make sure that you're able to see all of the questions. And if you can't, that's just downright weird because they are set to everyone. Yeah, they're set to everyone. And what you will need to do is, I notice, Robert, you have a question here. Your question is posted to host and panelists in your drop down above your chat, that blue box. Click on that, change it to everyone, and then everyone will be able to see your question. Okay, I think we got that. So going back to this example here, guys, one of the things that I want to show you is an example using the enhanced plan, because the enhanced plan is our most popular plan. So if someone is admitted into the hospital and they have the enhanced plan, they're looking at $1,000 benefit per admission, and they have up to 10 admissions per plan year. For intensive care in the hospital where they are admitted, and they are in intensive care for sickness, they're going to get a $4,000 benefit for a maximum of 60 days per plan year. If they are in the hospital for injury, they're going to get $6,000 with a maximum benefit per plan year. And then when those doctors come around and do their rounds with the enhanced plan, they're looking at $75 as a benefit, and that is going to occur at a max of 10 visits per plan year. Okay, now I'm going to go to the next slide and you are going to see what I'm talking about when we talk about non-intensive care confinement. So this is a continuation of the inpatient hospitalization. As you can see, it is also broken down by sickness as well as by injury, okay? But one thing that is really nice about this particular side of the plans and things I want to point out is that every year for the first 3 years that a policyholder has this plan, their benefit amount will increase year 1, year 2, and year 3. And then after year 3, it will remain that amount until the policy is canceled. The other thing that is really nice about this plan is that on all plans except the guaranteed issue plan, the benefits per plan year are unlimited. That is huge, guys. That is huge. If you don't see that, that is absolutely huge. So let's use an example here so that you can get an illustration of how this actually works. So if we have the enhanced plan here and someone is confined in the hospital, you have a client that is confined in the hospital for sickness, and it's year 1, they are going to receive a $3,000 per day benefit as long as they're in the hospital, and that benefit is unlimited. If the admission happens year 2, the benefit is $3,750. If the admission is in year 3 and on, the benefit amount is $4,500. Now, looking at the confinement for injury, if you notice, the benefit amount does go up at this point. So you have a first year, the benefit amount is going to be $6,000. Year 2, it goes up to $7,500. Year 3, it goes up to $9,000. And once again, after year 3, it will remain at $9,000. And the maximum benefit per plan year is also unlimited when it comes to confinement. So I see a lot of questions here. So let's go in and look. So the $4,000, the benefit amount, yes, it is per day, which is awesome. So the benefit is normally assigned to the hospital. Anything that is not needed, or say they have another plan that's like a short-term medical plan that also pays, and then you have this pay. When you look at the EOB, there was benefit monies left over that will go to the policyholder or the patient. Yes, Meredith, intensive care units can be very expensive. But the good news is that I just had someone in my family that was in the intensive care. I wish they would have kept them in there longer, but nowadays they get people in and out of intensive care. So they don't keep them in there as long as they used to. So that sort of helps to reduce that cost. Okay, so Rhonda, you asked, the maximum benefit is 60 days. The maximum benefit is 60 days only for intensive care. The maximum benefit for inpatient, non-intensive care is unlimited. So that is what I was trying to explain in the beginning. There are different benefits for intensive care, and there are different benefits for non-intensive care. Non-intensive care has unlimited benefits. The intensive care has 60 days. Yes, I will, Timothy. I'll be touching on that. Okay, so guys, I am going to have to, otherwise I'm never going to get through this. I am going to continue with this presentation, and I'm going to have you hold all of your questions to the very end. Otherwise, you're not going to get the whole gist of this, and it's going to get very confusing. So I'm going to stop right now. I'm closing my chat window because I'm going to ask you to hold your question off to the very, very end because I want to get through this for you. So next, we're going to talk about surgery. So when it comes to surgery, and just to explain, surgery service received is between a covered person and must be performed by a surgeon and can be considered inpatient or on an outpatient basis. So either or, but it cannot be done in a doctor's office. So when it comes to surgical benefits, there are two tiers. We have tier 1, as you can see, and this is for the surgeon payment. You have tier 1 here, and you have tier 2. And I'm going to see if I can turn on my little light here. You have tier 1. Bear with me. There we go. We have tier 1, and then we have tier 2, and then we have outpatient. Tier 1 are specific types of surgeries, okay? Coverage for specific types of surgeries. I have, for your convenience down here, put in red the surgeries that are included in tier 1. They include, I'm not going to read them all, they include amputations, excluding fingers, thumbs, and toes. They include brain aneurysm surgery. I'll take a minute to let you take a look at this area down here because those are the surgeries that are included in tier 1. Everything else that is covered is under tier 2. Okay, so in going through this, let's take a look at what the benefits are for the surgeon tier 1. This is per surgery. The benefits range from $5,000 to $10,000 per surgery, and the maximum benefit per plan year is unlimited for all plans. Tier 2, which is everything other than what is highlighted in red down here, ranges from $1,000 per surgery to $5,000 per surgery. There's also outpatient benefits that come along with this. The benefit per surgery starts at $1,000 and it ranges up to $5,000. The maximum benefit per plan is unlimited for the value plan, for the fundamental plan, for the enhanced plan, and for the guaranteed issued plan. As you see, for the fundamental plus, it is 3 surgeries. For the fundamental, for the enhanced plus, it is 4 surgeries. Now, a lot of times people will then ask me, what is considered, how do I know if the outpatient is considered outpatient and what is the criteria? I'm going to go over that with you now. The criteria for outpatient is that the surgery must be rendered in a licensed surgical center. The surgery cannot be otherwise performed in any other setting, such as a doctor's office. The surgery must be rendered by a proper licensed surgeon, and there is no hospital admissions as a direct result of the surgery that's being performed. Those 4 things qualify for an outpatient surgery, okay? Now let's go into the assistant surgeon benefits that are available. Now, you guys know that most doctors don't do surgeries alone. There's always an assistant surgeon. Something that I want to point out to you is that the value plan and the guaranteed issue plan, neither one of them actually have any benefits that are available with this plan. So if you have someone that you sell the value or the guaranteed issue plan, please note that they will not have assistant surgeon benefits. So tier 1, tier 2, the same criteria apply as when we were talking about the surgeon benefits. Down here you will see it's the same exact surgeries that are considered tier 1, and remember, everything else is considered tier 2. The assistant surgeon for tier 1 ranges from $3,000 to $5,000, and the maximum benefit per plan year is 3 surgeries or 4 surgeries, depending on the plan type. The assistant surgeon tier 2, dollars per surgery is $1,000 all the way up to $2,500. Once again, the maximum benefit per plan year is 3 or 4 surgeries, depending on the level that is selected. Outpatient surgeries. This is also per surgery. It ranges from $1,000 to $2,500, depending on the level you select. The maximum benefit for outpatient assistant surgeon costs per plan year also range from 3 to 4 surgeries, depending on the level that is selected. Now let's go ahead and take a look at the anesthesia and the outpatient surgical facility. And I think someone might have mentioned this as a question, so hopefully this will answer that. So when it comes to the anesthesia, the same tiers apply as with the surgeon, as well as with the assistant surgeon. So just to be clear, tier 1 is everything, all the surgeries listed down here, and everything other than what is listed down here is considered tier 2. So when it comes to tier 1 anesthesia, the dollar amount is per surgery, and it starts at $500 and it goes up to $2,500. The maximum benefit per plan year ranges from 2 to 4 surgeries, depending on the plan that you choose. For tier 2, the per surgery benefit amount is $250 up to $1,000, with a maximum benefit per plan year of 2 to 4 surgeries per year. Anesthesia for outpatient. These outpatient situations. This is also per surgery. $250 all the way up to $1,000 in benefit. The maximum benefit per plan year can be anywhere from 2 to 4 surgeries. Now, I'm going to stop here because I want you to notice something. Anesthesia an outpatient surgical facility is not covered for those people who have the guaranteed issued plan. So if someone has been sold this particular plan, they will not have anesthesia coverage nor outpatient surgical facility coverage. The value plan does not have outpatient surgical facility coverage. As far as the other plans are concerned, it is per surgery. The benefit ranges from $500 to $750. The maximum benefit per plan year ranges from 3 surgeries to 4 surgeries, depending if you choose one of the 4 levels that are above here. Okay, so now we have the outpatient benefits that are available. So first, we're going to talk about the office visits. So the office visit, so we have our definitions correct. The office visit is a meeting between our covered person and their healthcare practitioner in the healthcare practitioner's office. It can also be a telemed or a telehealth meeting between the covered physician and the healthcare practitioner. Now, I read that to you for a reason. I know everyone on this call knows what an office visit is. However, I wanted to point out that when someone calls in telemed to get service, this service will also be included telemed will be included against the maximum number of benefits that are allowed per year, okay? Something new that I noticed that Cleveland Clinic is doing is that even if you use their what's called My Chart and you email them or send them a message and they deem that as an appointment based on the question, that can be conceived as an appointment and it will go against the maximum benefits per plan. So I told you the definition because you want to educate your clients, because in a minute, I'm going to show you how they can get free telehealth. Okay, so they don't have to use their benefits for telehealth. So the office visit benefits range from 75 all the way up to 150. The nice thing about this particular plan is that the benefit plan per year, the benefits that are available per year increases year 1, 2, and 3. So to illustrate this, if we're going to use the enhanced plan again, if someone goes into the doctor's office for a visit, this is per visit, the benefit that is be paid to the policyholder is $100. Year 1, they will be allowed 4 visits to receive this $100. Year 2, they will be allowed 5 visits. Year 3, they will be allowed 6 visits, and continuing on until the policy is either terminated or canceled, they will receive 6 visits at $100 per visit. Preventative visit care, remember preventative visits, there is a 90-day wait in all states except Pennsylvania for preventative visits. But once that benefit kicks in, it is per visit, and it is only available with the Fundamental Plus, the Enhanced, and the Enhanced Plus plan. Hope you guys are starting to see why the Enhanced is our more popular plan, because it's a lot more comprehensive. Now, this particular plan has benefits that range from $100 up to $150 with a maximum benefit per plan year of 1 visit up to 2 visits. Notice the value, the fundamental, and the guaranteed issue do not have preventive office visit benefits. Urgent care. If someone needs to go to urgent care, these are the benefit amounts. Once again, notice urgent care is not available with the guaranteed issue. This is a per visit benefit. It starts off at $100 and it goes up to $200 depending on which of the 5 benefit levels you select. The maximum benefit per plan year you're going to find is anywhere from 2 visits all the way up to 8 visits. As you guys notice, and I noticed this as I was going through it, the Enhanced Plus and the Fundamental Plus seems to be very heavy on office visits, type situations, urgent care, things like that. So I said earlier, when looking at these plans, don't assume that just because it says plus, it has more benefits. It has more benefits in some areas, less in others. The plans are just different. You have to review them to make sure that you're looking at what your client is needing. Okay, the next section that we're going to look at here is radiology, laboratory, and observation units. So with radiology and laboratory, that also the benefit also includes the interpretation of the radiology and laboratory services, and is paid as a single benefit. Very important, because a lot of companies don't spell that out, and then you get a separate line item for reading the test, and people don't know about it. Our benefits here at Allstate, they include the interpretation and the reading of all radiology and laboratory tests, and it's billed and it's paid as a single benefit. So for radiology, we're looking at a per visit benefit ranging from $200 up to $300. The maximum benefit per plan year can be anywhere from 1 test up to 5 tests, depending on the level that is selected. Laboratory, a little bit different here, so pay attention. It is a per visit benefit ranging from $50 to $75. Now, with this, it also has a max benefit per day and a max benefit per plan year. So I'm going to illustrate this using the enhanced plan. If someone doctor gives them a laboratory work, that 3 different type of tests that are required, and they go to the lab, and they get all 3 tests taken care of, they will receive benefits for only 2 of those tests at $75. However, if they do 2 tests now and do the 3rd test another day, they will be able to reap the benefit of the $75 benefit for all of the tests. And the reason why is because the maximum benefit per plan year is 5 tests, despite the per day benefit of 2 tests. So I'm going to open up my chat. And on that question right there, do we have any questions or confusion? Yes, this is being recorded. Okay, great. So once again, we're going to go to the observation unit. Once we get past this, guys, it passes by pretty fast. The observation unit is not available with the value, the fundamental, the enhanced, nor the guaranteed issue. It is only available with the fundamental plus and the enhanced plus. The benefit is a per visit benefit of $1,000 for the fundamental and $1,500 for the enhanced plus. And I'm sorry, fundamental plus, and $1,500 for the enhanced plus. The maximum benefit per plan year is 1 for fundamental plus and 2 days for the enhanced plus. Looking at emergency and the available benefits under emergency, we have ground ambulance, we have air ambulance, as well as emergency room. So when it comes to the ground ambulance, we're looking at a per trip benefit. That per trip benefit ranges from $500 up to $1,500, depending on the level that is chosen. The air ambulance benefits is a per trip benefit that ranges from $1,000 to $2,500. Just like with the ground ambulance, the maximum benefit per plan year is 1 trip. Emergency room, please note, the guaranteed issue does not have benefits for the emergency room. So if you're selling that, make sure they're aware of that. All other plans is a per visit benefit, and it ranges from $100 to $500. The maximum benefit per plan year ranges from 1 visit to a total of 3 visits. Okay, and finally, we're going to talk about transition care and prescription care. So with the enhanced plan only, and the benefit amounts are the same for each one of the things that I'm about to talk about. The skilled nursing facility care is available with the enhanced. The home health care also available. Hospital care is also available. Each one of these is paid out on a per day basis, and the maximum benefit per plan per year on all 3 is going to be 50 days. Okay? Next, we have the outpatient prescription drugs. So the value as well as the guarantee does not have prescription drug benefits, but the other 4 do. The enhanced plan offers the most benefits at $25 per prescription being filled, with a maximum of 50 fills. The other 3, the fundamental plus, and the enhanced plus, have a $15 per fill benefit for a maximum of 50 fills for all 3 of them. Okay, so at this point, I am going to stop and look at your questions, because I know that it looks like there are a lot, and see if we can get through them really quick before we move on. Regarding the benefits paid over the charges, does the policyholder have to go to the hospital to get that dollar? Yes. So in order to receive any benefits, the policyholder has to have the covered event done in order for them to be able to get the benefit. If they don't go to the hospital, if they don't go to the doctor office, they don't have the lab work, there are no benefits paid. Yes, the guarantee does have great benefits. The training will be available on some sites that will be recorded, so you can look at it. Pre-authorizations is not required. This plan isn't, it is a simplified underwriting, so there are medical questions that will be asked. Timothy asked, pretty much impossible to know 100% what the cost would be. Would you recommend having the advocate communicate with the doctor's office before the surgery to be clear on the procedures and what's covered? That is definitely something that will not hurt. Telemed is not unlimited with the plan. However, it is unlimited with the Life Association, which I will be sharing with you shortly. Emergency room is per day. And going back, the emergency room varies from $100 to $500, and that is per visit. So, you know, it's for the one day. If it's more than one day, it either goes into observation or it goes into them being admitted into the hospital. Yeah, so I'm going to go over in a second. So a lot of these questions are things that I am going to be going over in a little bit. So I just wanted to stop here because I know this is a complicated area and people get tripped up on this, but I wanted to give you guys a clear understanding on how to read the benefits. With advanced imaging, as far as I know, Rhonda, it is, but that's a very, very specific question, and it's really hard to answer very specific questions. If you want me to find out about advanced imaging, please email me and I'll give you the email address at the end of this and we can find out about advanced imaging. That's just too specific of a question for me to answer during this training. You're welcome. Okay, so let's go ahead and keep going. The network that this plan uses is the First Health Network. Love this network. It has over 5,000 hospitals, over 100,000 ancillary facilities, almost 700,000 professional providers. And then this is what I love. 96% of the US population has access to a First Health provider within 20 miles. That's huge. So there's accessibility is there. Discounts can range from $30 to $50 for in-network care. Now, guys, one thing that I want you to remember, this particular plan does not require you to stay in the network. You can go in the network or you can be out of the network and the benefits are going to be absolutely the same. But I hope you see the importance of staying within the network, because if you're in the network and you're telling your clients that they're going to get this 30 to 50% discount because they are in the network. If they go out of the network, they will not receive that discount. Now we're going to talk a little bit about how the plan works, additional coverage, and the Life Association. Okay, so how does the plan work? Prior to treatment, what we want to do is to actually go onto the First Health website and search for the providers in which they are looking for. At that point, you will instruct them to go ahead and schedule their appointment with their provider. Once they are at the doctor's office, they do want to present that ID card when checking in for the appointment to make sure that coverage is applied correctly on the EOB. Next, what's going to happen after the treatment. The EOP is going to show the members their network discounts, and then it's going to further show them what the plan has paid. Members are responsible for paying any remaining balances after the plan benefits are paid. Members may receive the same plan benefits regarding of where they receive their care or how much that care costs. So it really doesn't matter, you know, where they go. We just really want to encourage them to go to the in-network. Now, when it comes to filling prescription drugs for those ones with prescription drug benefits, the only thing that they're going to want to do is go to the allstatehealth.com site. Under claims, they're going to get the prescription drug claim form. They're going to complete that. They must submit the claim form along with a photocopy of the prescription receipt. It must show the drug's name, the quantity, the prescription number, as well as the cost. If they try to use a generic, just cash register receipt, it will be declined. So it's very important that all of that information is included. Let's go ahead and look at an example here. This probably, hopefully, is going to bring it all together for you. Now, Michael here was walking his dog. He fell and dislocated his shoulder. He does have a health access fundamental plan. Michael went to the ER for treatment. During this treatment, his visit cost him $925 and his x-ray cost him $110. That's a total of $1,035. With his access fundamental plan, this is what Michael received: $390 for the network discounts, $250 for the ER visit benefit, $250 for the x-ray benefit. This leaves a total out-of-pocket cost for Michael of only $140 from $1,035. This is an 86% discount from what he would have had to pay without the access plan. And looking at somebody with an appendectomy, we have Leslie here. She had a appendectomy, and this is considered a tier 2 surgery, not a tier 1. It's not on that list. The surgery did require an overnight stay. She was on her second year of her Allstate Health Fundamentals plan. So her Access Fundamentals plan, she was on her second year. Her total charges for being in the hospital was $12,001, and that included a hospital fee, a surgeon fee, and an anesthesia fee. After her Access Fundamental Plan benefits kicked in, she received a $2,000 Tier 2 surgeon benefit, a $500 anesthesia benefit, a $500 hospital admission benefit, and then a $2,500 daily confinement benefit. And that is because she is in the second year of her plan. If she was in the first year of her plan, that benefit would have only been $2,000, but she was in the second year of her plan. Her total out-of-pocket was reduced to $2,300.65, which is an 81% discount. I do want to remind everyone that we are a #1 insurance company when it comes to supplemental plans, A&E plans, critical illness, term life, all that good stuff. This is really just to remind you guys to make sure that you are bundling when you are meeting with your customers. It's really important to do it right the first time. Don't wait until you have to keep calling them back to try and do it right the first time. Okay, let's talk about this life association because this is pretty important. Remember when I said, if they use the telemed for their office visit, it can go against their maximum benefits per plan year. However, if they use the life association, telemed is for life. There is no additional cost. There is unlimited consultation, and it's 24/7 with a licensed physician. So you want to coach and instruct your clients to be utilizing this life association membership. The other thing on here that is really helpful is this hospital and diagnostic facility negotiation. If they receive a bill, they don't understand, they're saying, oh my God, these costs are outrageous. The Life Association will negotiate, let's say that again, negotiate hospital and diagnostic services on their behalf. There are some things that need to be remembered. They cannot have a bill that's older than 60 days and still get this service. It cannot be in collections. They cannot have paid their bill and then want to negotiate it. So really what it is that they want to do is as soon as they see that bill, that EOB, they want to then start the negotiations immediately, okay? The next thing that I find very helpful, I use it myself, is the Active and Fit. It just keeps us healthy. It is only $25 a month, although I think it is $28 a month now. All the rest of these things, you can instruct them to read it in their packet. Great information to know. They could find it helpful, but it's not necessarily pertaining to their health benefits. So just make sure you're letting them know to read their association packet, especially about the telemed for life and the hospital and diagnostic facility negotiations. Let's talk about the eligibility, state availability, discount rates, limitation exclusions, and enrollment and payments. Okay, so when it comes to eligibility, primary applicants need to be between the age of 18 and 64 years of age at application. This plan is renewable up until the customer turns 65. Dependent children can be on the plan up to the age 26. Child-only plans are available in some states, not all, and they can start as early as 30 days and go through 17 years old at the time of the application. And someone asked earlier, are there health questions? Yes, there are health questions. These are the states in which the plan is available, and this is always growing. You do want to note that in South Dakota and in Pennsylvania, the fundamental plan and the enhanced plan is not available at this particular time. Discounts. So remember I was talking to you about the ACA plan and how important it is to talk to our customers about this plan. To our ACA customers, well, Allstate is helping you with that because in some states where it is available, there is a 20% discount for customers who purchase the Allstate Health Access plan along with the ACA plan. And this discount does remain for life. Now, there are, of course, limitations and exclusions. Right here, I just listed some. If you want to have the complete list of the exclusions, all you need to do is go on to allstatehealth.com, go to the marketing materials, look up the brochure for the appropriate state, and in the very back of that brochure, you will find all of the limitations and exclusions. Of course, pre-existing conditions are not covered for the first 12 months. After 12 months, they may be covered. So, but for the first 12 months, they are not covered. Dental procedures are not covered, cosmetic surgery, weight loss, chronic pain, pregnancy, and maternity. So this one here, I just want to point out, regular pregnancies and maternity is not covered. However, if someone has a complication to a pregnancy and requires an emergency cesarean, that is actually considered a tier 1 surgery and it is covered. So, but that is because it's an emergency. Workers' comp not is a limitation. Dangerous activities, bungee jumping, flying, jumping off of a mountain, things like that. Those are things that are pretty dangerous to do, even if you have a parachute. Those are not covered. Mental disability and chemical abuse are also part of the limitations and exclusions. Enrollment is the same pretty much for all of our plans. It can be any date between the 1st and the 31st and can be as soon as the very next day. That initial payment must be any date between the time of the application, but it has to be before the effective date. Reoccurring payments are encouraged, and they can occur anytime between the 1st and the 28th of the month. Forms of payments that we will accept: electronic funds transfers. That's where you give that account number and the routing number so that it is automatically debited from bank accounts. Visa, MasterCard, or Discover. We do not accept American Express. Of all of these, I encourage you to let your clients know that EFT payments are the safest way to do it, because all the rest of these, including debit cards, have expiration dates. And I just talked to someone yesterday whose policy was canceled because her credit card expiration date expired. She was out of town, didn't realize it. It's a real thing, guys. It happens. Okay, so now we're going to talk about agents and members' benefits really quick. You find that, I've been saying this throughout the entire training, you will find that at allstatehealth.com there for broker services. There are agent tools for you there, as well as YouTube videos. So for those of you who are asking, is this recorded? Yes, it is. You will be able to watch it on your various company websites. But if you also want to take a look at it, it is also available on our YouTube channel, which you can find on this website. You can explore coverage for your clients or for yourself on this site. The marketing materials, that's what I use the most, guys. When you guys are calling me and you're asking me different questions, first place that I'm going to see if I can find the answer is within the marketing material. So it's a great resource for us as trainers, but also for you. Next, we have the existing customer portal that is used for our clients. That's where they can go and find doctor office and facilities that are within their network. They can get general policy documentation, those claim forms I mentioned earlier for prescriptions. This is where they're going to go to find those claim forms. And last but not least, when you are enrolling them, they're going to go to their member portal in order to complete that enrollment. by authorizing the payment on this site, as well as agreeing to the terms of the policy. In addition to that, they can go on this site to view policy documentations. They can check their payment history. They can also get their temporary cards. Really important. Let them know, because if they have to go to the doctor right away, they need a card. They need their card. They can print their temporary card on this site until their permanent card arrives to them. This right here, guys, is just a disclosure, just letting you guys know it is very important for you when you're selling the ACA plan to make sure that they know that the coverage does expire if their coverage does expire, or if they lose eligibility for coverage, they might have to wait until the next open enrollment to get health insurance coverage. That's very important for you to be communicating with your clients regarding ACA. The other important thing is Allstate Health Access is a limited medical plan that pays set dollar amounts when a member receives particular services, no matter what the provider charges. Members are responsible for any remaining costs not covered by the plan benefits. Limited medical plans are not major medical insurance and do not meet the standards set for minimum essential coverage by the ACA. And I hope everybody knows that, but I am required to read that. As a recap, the Health Access plan is an awesome plan. If you guys need additional help, please reach out to us. I would love to talk to you about this plan. I think it's just an awesome plan. It does have set dollar amounts to help with health care costs. There are 6 benefit levels, including a guaranteed level. It's very easy to understand and easy to use. There is no lifetime limits with this plan, and they can pick any doctor or hospital they want to go to. In addition to that, we want to make sure we're letting them know it's better to go to the First Health Network to get the discounts. There's no waiting period for sickness nor for injury with this plan. There is only a 90-day waiting period for preventative care in the state of Pennsylvania. That is only a waiting period of 30 days. As always, guys, I'd like to tell you that Allstate Health Insurance has roots that date back to 1939. We've been given an A+ rating by AM Best. We specialize both in short-term medical as well as supplemental insurance plans. If you need any help, have any questions, you can reach us right here, ngahtraining@ngic.com. If anything comes up and you have a question, please don't hesitate to reach out. Bye, everyone.